Good afternoon, everyone, and welcome to our Mental Health TeleTalk. I'm Elyse Cohen, and I lead the U.S. Chamber of Commerce Foundation's Food, Health, and Wellness Network, working in partnership with the private sector to improve health and well-being for all. This TeleTalk is taking place in collaboration with the Chamber Foundation and Tata Consultancy Services Digital Empowers COVID-19 Virtual Event Series, a national campaign that celebrates the crucial role that technology plays in improving our world and proving now more important than ever to fighting this pandemic. Amidst the social isolation and uncertainties in health and economic impacts, one thing is certain: how we as individuals, caretakers, employers, and a global community take care of ourselves and others matters. In the Chamber Foundation's recent case study report, Cultivating Wellness in the Workplace, we've highlighted how business leaders are stepping up to address mental health and well-being in more innovative and profound ways than ever before. We also know that people around the world struggle on an individual level with the impact of COVID-19. The collective level of stress, anxiety, and uncertainty that we're feeling is translating more and more into the workplace. That's why we at the Chamber Foundation have launched this new pop-up virtual event series that focuses on all facets of mental health, well-being, and community building through what we're calling Mental Health TeleTalks. Today's TeleTalk, Digital Mental Health and Virtual Community Building, brings together some of the greatest minds in mental health and in the mental health and wellness space to discuss how individuals and companies can leverage technology to support mental health and well-being and create virtual connections. I am incredibly honored to be joined today by a distinguished group of entrepreneurs and mental health leaders who have truly built businesses with mental health and social impact embedded into the DNA of their organizations. While telemedicine, virtual medical appointments, and virtual communities may be new to many of us in this new COVID-19 era, these cutting-edge leaders have been trailblazing the way for virtual care and connection long before COVID-19. Please join me in welcoming Roni, co-founder and head of clinical services at Talkspace; David Markovich, founder and CEO of Online Geniuses and co-founder of 18%; and Karan Singh, co-founder and chief operating officer at Ginger. Before we begin, I just want to run through a couple of quick housekeeping points. The webinar will be broken down into 3 segments: speaker introductions, a panelist discussion, and then we'll take Q&A from the audience. All of you are muted, but you can submit your questions through GoToWebinar's chat function on the right-hand side of your screen, and I encourage you to do so as soon as those questions come to mind. I promise we will get to as many as possible before wrapping up our conversation at 4:45. If you do happen to have questions that are sensitive in nature or would like to talk through specific strategies for your company, please include offline follow-up in your chat message. Finally, today's presentation will be recorded and archived on the Digital Empowers and U.S. Chamber Foundation websites. We will share the link to view this online as part of the post-event follow-up, as well as any resources that are referenced in today's discussion. So with that, let's get started. And to start, I want to ask each speaker to tell us a little bit about how would you explain your job and the mission of your company as if you were talking to a close friend. Let's start with Karan.
Elyse, thank you so much. It's incredible to be here. Really, really honored to be talking about this topic at this time, especially. Again, my name is Karan Singh, a co-founder and chief operating officer at Ginger. And Ginger is an on-demand mental health company. Think of it like a virtual clinic for your mental health with a team of coaches, therapists, and psychiatrists, really all working together and leveraging kind of content and technology to deliver care in seconds. 24 hours a day, 7 days a week. Our vision is a world where mental health is never an obstacle. It feels especially important in today's climate where we're just all feeling an elevated level of stress and anxiety as our lives have been upended. And so we typically work with large and small employers and health plans that offer Ginger as a benefit to their teams. And my job in today's climate is to continue to scale our capacity to really meet this incredible demand that we're seeing as kind of the distinctions between virtual care start to go away, and these kinds of care models are really starting to see a real level of adoption. So excited to chat and share more.
Excellent, thank you. David, let's hear from you.
Thank you for putting this together. As someone who hosts virtual events, they look a lot more simple when you're watching them, and there's a lot of work that I witnessed that you're putting together, and I know you put together. So thank you for that. It's cool, and it's an interesting topic. I usually try not to participate too many in these, but this is a particularly one targeted towards me. So I've been a community builder essentially my whole life. I ran dozens and dozens of communities across all niches. I currently run 6 communities from the hedge fund space to the venture capital space. I run a community now that's focused on fighting the coronavirus, which has thousands of members. But most importantly, I run a nonprofit called 18%. And what 18% is, it's a way for people to get peer-to-peer support for free wherever they are in the world, in a matter of minutes or seconds, where you could just log in and say, hey, I'm dealing with bipolar, and you could speak to someone who's fought the exact same battle as you and get encouragement. We have a wide range of people that join, from parents who have kids who are suffering, from people who just need someone to chat with, right? Like, I need someone to relate to. We did see a big peak, unfortunately, during this time. We're happy that we existed, like you said, way before I even knew when I still thought Corona was just a beer. And I'm happy that, that we have a place, and I'm happy that to be on the panel with 2 others who are fighting the same battle as I am.
Wonderful, thank you. And last but not least, Roni.
Hi everyone, I'm Roni Frank, co-founder and head of clinical services at Talkspace. Talkspace is a digital mental health platform that directly connects people with licensed, credentialed therapists and psychiatrists via text and/or video chats. We have a network of over 5,000 mental health providers. Our mission is to make mental health care accessible and affordable for all by removing main barriers such as cost, access, and stigma. My journey to the mental health world started when my husband Oren and I experienced a crisis in our relationship. Our marriage was falling apart, and we decided to give it one last chance in couple therapy, which literally saved our marriage. Therapy helped me in so many ways, and that inspired me to leave my career as a software developer and go back to graduate school to study psychology. And about 2 years into my master, I realized that the mental health system in America is completely broken. If you want numbers, 2 out of 3 people who are diagnosed with a mental health issue have no access to care, which is a disgrace. We're talking about tens of millions of people that cannot access services. We all know that life comes with many challenges, and we all struggle from time to time, even before the pandemic. That's part of the human condition. It could be that you're dealing with a painful divorce, or you lost your job, or dealing with difficult family dynamics, relationship issues, childhood trauma, etc. And those challenges are painful and stressful and very often lead to depression or anxiety or other mental health issues. However, as I mentioned, mental health services are not accessible for most people. So Oren and I were passionate about fixing this problem, mainly because of our own experience, knowing how valuable it could be. We wanted to open access to quality mental health care to every person in need, and this is how the vision of the company was born. We did our research and learned that there are 3 main barriers to traditional mental health care. The biggest barrier is cost. This is not surprising. The second barrier is access and convenience. And the third barrier is stigma. Unfortunately, even today, many people still feel ashamed about their mental health struggles. So after learning about the barriers to traditional therapy, we started to explore how technology, how a digital platform could remove those barriers to make mental health care accessible and affordable for all. And we launched our first product in 2012.
Wonderful, thank you. So when we talked on our prep call, a lot came up about sort of the shifts in trends that you all are seeing from before COVID-19 into where we are now in terms of usability, customers, the issues that people were coming with, and it's almost like that barrier has disappeared a little bit. Can you share with us a little bit about what you're seeing, how individuals and how employers are leveraging the resources, and what some of those trends that you're seeing? I know specifically, Karan, I saw that Ginger released some really interesting research earlier this week. And so I'd love to hear, I'd love folks on the call to hear a little bit about what you all are seeing in your companies.
Yeah, absolutely. I can kick us off. You know, I think as Roni was just saying there, this is clearly an everyone problem. This is something that most everyone is going through. And I think this crisis and the way in which the pandemic has been unfolding, I think there's a recognition now that it's not only a physical health pandemic, but a mental health pandemic. And that we're starting to see this bubble up, not only across the United States, but frankly, internationally. We're actually live in about 23 countries internationally and have been seeing kind of a level of anxiety and stress really bubbling. We recently fielded our second annual Workforce Attitudes Report, where we survey a number of employees across the country, and we found that nearly 70% of workers claim that COVID-19 was the most stressful time of their entire professional career. And that was in comparison to the September 11th terror attacks, in comparison to the 2008 Great Recession. And this held true across every age, every demographic. So I think you've heard from all of us so far, I think point A is clearly that this notion that mental health is really only for a select few. I think we're starting to see an appreciation that this really does impact most everyone, and it impacts really business continuity planning. So as it relates to what it means for a lot of our employers, we're seeing just both a incredible uptick in utilization from our existing member base, so a 55% uptick pre-COVID to today, whether it's with coaching services or with our licensed clinicians, our therapists and psychiatrists. But we're also just seeing an incredible uptick in kind of the demand from employers of all sizes. As compared to January, from today, we're seeing a 4x increase in the number of folks who've expressed interest and or are launching. And so what's exciting about that is I think people are taking some action. What's challenging about that is that there's a lot of change and it's hard to predict, and understanding and recognizing when all of this is going to quote unquote end is pretty tough. But I think what it means is that virtual is no longer on the sideline. It is the only option, and as I think you'll hear from all of us, it's an option that has been working incredibly well for over a decade. Similarly, we started the company about a decade ago now, and out of research we were doing it out of MIT, and have been proving out consistently over years. And now I think we're all getting a chance to really demonstrate this at a much more impressive scale.
Excellent, thank you. Roni or David, do either of you want to chime in there with some of what you're seeing, either from the community building perspective, David, or Roni, just from topics and interest and what people are saying and demand?
Okay, so I can share with you, naturally anxiety and fear have heightened dramatically in the last few weeks. At Talkspace, we see a spike of 65% in demand. We also see a spike in supply. We're getting 5 times more therapist applications a day since therapists cannot see clients in person. Our therapist network of over 5,000 licensed therapists share that they have never seen such an overwhelming level of anxiety and fear before. In terms of what clients are dealing with, the issues that they are sharing on the platform, what we hear from the therapists, of course, we see a significant spike in medical workers. I'm talking about doctors and nurses on the front lines, dealing with so much burnout, fear, overwhelming pain in the hospital as they try to keep it together to be able to continue providing services. Another topic that we see, many of our clients are extremely anxious about losing their job, or they already lost their job. So of course, financial insecurity, which causes significant distress. Our clients talk a lot about loneliness. Social distancing and quarantines leads to isolation and depression. We also see a lot of people that either they or the loved one suffer from underlying health conditions such as heart issues, diabetes, cancer, all chronic illnesses that cause you to be more susceptible to the virus. And this fear leads to panic attacks, to insomnia, and more. Relationship under quarantine is a huge stressor as well. Couples who dealt with some level of relationship issues before the pandemic find themselves now really struggling. You know, while they're dealing with all other challenges and kids at home, it really takes a toll on the relationship. Unfortunately, we also see uptick in domestic violence, which is pretty devastating. And last but not least, a lot of people are just grieving the loss of normalcy, the loss of freedom, the loss of joy, which can turn into depression. So as we navigate this new environment, we are facing an unprecedented mental health crisis in the country.
Great, thanks, David. Do you have anything to add there?
I think a lot has got covered. An interesting trend that I'm noticing is a lot of people are talking more and more about how they're struggling from a mental standpoint than I've ever seen in my life. So I get that more people are struggling, but I get on calls now with our clients, partners, sponsors, and people are talking about it more like, hey, like when you're asked how you're doing, some people are saying like, I'm on an emotional roller coaster. You would never hear that before this started on a Zoom call with someone that you're doing business with. You'll be like, what? Now people are getting a little more open. Like I speak to people and they're saying, I'm having panic attacks on our initial phone call. And I'm like, I get that. I feel like that. And I got the virus actually. So I heard about Corona in February, and I'll call it COVID-19. That makes me sound more professional. But I think Corona. Sometimes I even niche it out to say Rona. But I heard about it in like February, early February. There was like this virus in China, and it's killing people. It kind of reminded me of Ebola. So, and then fast forward March, we find out that our offices are closed and everyone's getting work from home, and it really hits you, and you're like, wait, this is kind of fun and exciting, but it's also kind of crazy because nobody really knew like, am I going to catch this virus? Am I going to die? And at that point, I actually started feeling a little sick. So in my head, I was like, wait, is this anxiety mixed with paranoia? Because there's no way I got this virus. I just heard about it. I'm not one of the first people that I know that got it. Anyways, I started getting a little bit more sick. I went to City MD. I got the test, and for like a week, I couldn't get out of bed. But I was convinced that it was just anxiety and paranoia, just because like, hey, there's this virus going around. And anyways, I got back the result, and it was positive, and I was shocked. And I was like, I can't believe I have this virus. I don't know. There was like no news. I couldn't be next to anyone, so I couldn't have any visitors. I'm stuck in a studio apartment in New York City. I am at the worst place emotionally and physically. There was a point when I was questioning, like, I was calling like the support for like City MD, and my MD, nobody's picking up, right? Everyone's slammed. So I'm like, wait, am I gonna die? That was literally a thought that went through my head. So I really started feeling it, and I was kind of coming to terms with whatever outcome would happen. But for like a week, I was secluded, not talking to anyone. I barely ate, and I was just really sick. And then when I got out of it, I felt really good. I went for like a run, and I came back again. Trust me, guys, stay at home. You don't want to get this virus. It feels like it's been like a month, and I still feel it coming back. So anyways, and then when I started getting on calls with people, and I started talking, and I'm like, yeah, I was able to be empathetic to to what people went through and what people are going through. Because I got sick, right? Another person lost somebody they loved. Another person lost their job. Another small business is not getting funded. They're closing down. Everyone had these struggles. And we were in New York, right? I think, Roni, you're in New York, right?
New
Right,
Jersey,
okay. Well, we're going to count
but very close to Manhattan, yeah.
we're gonna count this. And
Yeah,
Karan, where do you live?
Tenafly, New Jersey.
I'm in.
What?
Sorry, David. I'm in San Francisco.
Oh, you're in San Francisco. So we're not going to count in this one. We'll take New York. So no, saying like in New York, and Roni knows this, like we're all like about like New York tough, like let's not show emotions, let's like power through it. And you see some of the strongest people, it's taking a toll, and
Yeah. Well, so thank you. Well, I'm glad you're feeling a lot better. So we have a lot of folks on the phone who are employers, companies, small, large, all different industries. And I think, a lot of what businesses and workplaces are struggling with is twofold, is how do they just create normal connection and consistency with their employees? Just, simple community and connection building. Do we make people do video calls? Do we create consistent check-ins? Things like that. And then really also, increasing their approaches to how they talk about and the type of programs that they're running for employees to address mental health and well-being, to normalize the conversation. And for some organizations, it may be the first time that they are even communicating to employees about this topic. And for others, it may be simply adapting a program that has existed. So I'd love to hear from you all on some tips that you might have for companies on the phone on how to communicate with employees. How do you communicate, and how do we sort of share resources that exist, particularly resources like yours, and how do we normalize the conversation so that employees feel both supported and connected? And before I let you guys chime in, I just want to remind the audience, please submit your questions if you have any into the chat feature on the right side of your screen.
Yeah. So Elyse, I could take this because we actually had quite a few phone calls with companies that reached out and like, hey, first of all, how do we, like, you could see when an employee is not feeling well when you see them in person. How do we know who's at home? And I always suggested against checking in on employees. First of all, it makes them feel a little bit invasive. It's like your parents, like, how are you feeling? How are you feeling? They're not gonna tell you anyway, right? I mean, it should happen more organic, like do a virtual happy hour and get a read on everyone's face. And if you see someone a little bit down or exhausted, you should have someone that's close with them at the company ping them. I think companies are looking at Talkspace and other similar programs and offering that as a perk, right? Since they're not doing they should just say anonymously, we'll reimburse you for anyone that wants Talkspace or another mental health app and stuff of that sort. But I think like these virtual hangouts that are very casual, consider them like, let's do a check-in. How is everyone feeling? I think that's a little bit invasive.
Karan, do you have?
Yeah, absolutely, David. Well, first, glad you're feeling better. You're looking good, at least over webcam. Roni, I don't know if you had a visitor there earlier, but I'm half expecting my 4-year-old daughter to walk through my door soon here. And I feel like that's so much of what's happening now, is like these walls are starting to fall, and that I'm, at least even within our own team, starting to feel a deeper level of connection and intimacy that would have never been possible before, because we're not usually in each other's homes in this way. And I feel like that's kind of part of the advice I'd share with potential employers, is sort of embracing that messiness, that as these walls fall, we start to actually build, in some ways, the deeper level of trust and connection. It can be challenging, but it also is an incredible opportunity to really start to build a stronger, kind of tighter network, and to be able to communicate more consistently with your team, compassionately, transparently, and frequently. It's a kind of strategy we've been using to communicate on both a daily and weekly basis, so that the team hears from all of us, especially leadership, to just understand what's going on and how we're approaching internally and supporting our own team's mental health. But then kind of similarly, David, to what you were describing, whether it's a Ginger or a Talkspace or a set of these virtual options, which are now the options, I think the reality is it's clear that as we've talked before, the existing mental health system is broken, and it's broken from a stigma, cost, quality, and access perspective, and that this pandemic is laying those inadequacies to bear. And so as a result, a lot of people are getting exposed to and accessing these sorts of services for the first time, and they're realizing that they're incredibly powerful and they work really well and they're convenient, highly satisfied, can be actually lower cost in some cases, and especially in partnerships with an employer plan, can really start to kind of get delivery out to a wide swath of the population. So I'd say, that the second big piece of advice is really reevaluate the set of benefits and mental health resources you're currently offering your team. Really rethink whether those traditional approaches are adequate. They're important, they serve a purpose, but they're not sufficient, especially in today's environment, to meeting the full magnitude of the need.
I'd like to add, thank you.
Yeah, Roni, I know we talked a lot about storytelling and vulnerability.
So let's start with, what we're doing now as a company. So the whole company is, like many other companies, on Slack. What we did, we started more companies channels to allow connection around, more specific and relevant topics to cultivate sense of community. For example, we have a channel for employees who are parents, and it allows them to share resources around, dealing with kids at home, online school, supporting each other, etc. We're doing everyday lunch together via Zoom. We're doing once a week happy hour via Zoom, and that is just very conversational and fun, just to make people feel more connected, more together while we're all working from home. We're doing now weekly all hands, just to make sure everyone is updated about the most important things that are happening in the company. So I would say overall, just more communication, leverage technology, more kind of virtual groups to keep the sense of community. It's also very important now, since employees naturally are stressed out, and this supporting community is very effective. Now, I also like to mention that, companies' culture and values always start at the top. So leadership must be a role model participating in those activities. It's also important for leaders to show vulnerability. And example would be that you're sharing your own struggles. I'm also a mom, dealing with 2 girls at home, trying to kind of navigate my life, working, helping the kids with homework, making, dinner, etc. And when you're sharing as a leader, as a manager, it makes the team feel more safe to share about their own issues, and it creates trust. And when employees feel that they trust their leader, they trust their company, when they feel it's like a safe environment to share, it really increases their satisfaction level, and it encourages an authentic dialogue that eventually contributes for both the employees and the company. And it allows people just to relate to you better as a leader when you are sharing about, and when you are showing vulnerability.
Yep, we talked about that a lot. So I have a couple more questions, but we're starting to get some questions that I want to address from the audience here. So we've got someone who's a nonprofit with about 40 staff who work with frontline healthcare workers across the country. And they identified the need for mental health support for their partners of about 600 staff and their direct staff. They'd like to do webinars and other tools that touch on self-care, and they're wondering if any of you have resources or advice for an organization like that on what sorts of things that you're seeing are working that they can offer.
So we're talking about healthcare workers?
Yes. Yep.
Okay.
They work. We're a nonprofit with 40 staff and work with frontline healthcare workers across the country. I think they want to be able to support both their internal teams and also the frontline healthcare workers that they work with.
So I'd like to take this one. You know, as the leader of the space, we're doubling down on our mission and we're offering additional mental health resources. We launched a donation program last month to offer free services to healthcare workers on the front lines. We are donating 1,000 months of free therapy for those healthcare workers across the country as they desperately need emotional support. Michael Phelps, who's our partner, joined this program as well and added 500 additional months of free therapy. And our network of therapists is joining with 300 months of donation that are matched by the company. We are also offering free support groups on Facebook led by Talkspace therapists who are sharing with Facebook users guidance, tips, advice about how to manage the anxiety, the isolation, the uncertainty we're all dealing with nowadays. We have over 5,000 members in those groups, and it's growing quickly.
Thank you. Can you talk a little bit more about those Facebook groups? And then Karan, I'm going to move on to you. I want to get your response there. I know it was fascinating, Roni, to hear over the phone these Facebook groups, because I think folks on the phone would probably be apprehensive about them. And when I heard that you had groups of strangers that were collaborating with each other and the success that was happening in these informal rooms, you quickly learned that a lot of individuals are just seeking support and interaction and conversation. If you just want to talk for a minute about that.
I'll do it quickly. So David mentioned before, stigma has decreased dramatically, and it's so interesting to see, you know, thousands of people of members on this group sharing and supporting and really kind of leading very intimate discussions, very personal discussions, you know, in front of thousands of people. It's very inspiring to see the level of support that's coming just from the peers, not only from the moderators. And it's open for the public. We're doing it to offer support and relief for people who cannot afford our services right now. And I'm inviting everyone to be part of those groups.
Excellent. And David, what are you seeing on you? Because that is exactly what 18% is. So if you want to talk a little bit just about, you know, what you're seeing in these rooms and these conversations, and that these are essentially strangers.
Yeah, so I'll just address the question from the nonprofit. If you want to know what you could do to help, email the people that are currently utilizing your nonprofit or whatever work you're doing and ask them what would be helpful. You could even create a small little poll and say, here are 5 things. We don't know which direction we need to go in, but we want to be able, we have 40, you know, we have 40 staff. Where should our resources going? Because you may go in a direction that already exists. You may go start focusing on something that's not needed, and you might as well just ask. And that's what we're doing too. So we have thousands of people that join. I mean, we have thousands of people that utilize our network. We're just a little background about how we get people to use our network. And Elyse, I explained this to you earlier. So we deal with low risk mental health people who need peer-to-peer support. So if you call the suicide hotline, we're partners with them, the main national suicide hotline. They get 2 billion calls a year. When you put that in perspective, to a country like America has 300 million people, so they're very overwhelmed. And we deal with low risk. That means people that are not at risk at hurting themselves or hurting other people. And they send, a lot of times they'll call they'll text the crisis text line, they'll call suicide hotline. If they're not in danger, a lot of the people that pick up the phone or answer the text are trained to send them to 18%. They join 18% and they could speak to other people who are dealing with struggles. And what happens is a lot of times people join when they're down. So they're joining when they're in a dark place. They'll get lifted up and then they want to get back to the community. So somebody else new joins, and they're all random, right? So very few people knew each other from before. I've yet to see a case, but in our community, so in the past week, 40,000 messages were exchanged between random people that never met. And what's interesting is during the COVID time, there is a big increase of people struggling, but there's even a bigger increase of people having a hard time dealing with social isolation. So they just have no one to speak to. So in places like San Francisco and New York, you know, you could walk to the store, but you're in the suburb in Tennessee somewhere, you're in your basement, the only people you get to see is your family. Maybe you don't feel comfortable with them. It's all virtual. So we have people that come in, and similar to your Facebook groups, and similar to Ginger, like you could just discuss your feelings and how, you know, meet some friends and stuff like that. We started, and I recommend everyone doing this, is just for your audience, just create a list. Nami did a great, at least we were speaking this earlier, that just create a list of different support that people could find around the coronavirus or COVID-19, right? So whether it's paid, whether it's free options, and just email that out to your audience and say, hey, these are resources out that are not necessarily us. And that's what we do. We get a lot of people in, but also we shoot a lot of people out to where they need to be too, and the ones that stay.
Sure, yeah, and we'll be sure we have a resource page on the Chamber Foundation's website, and we will absolutely make sure to share that in our follow-up too. Thank you, David. Karen, I want to make sure you have a chance to answer that question.
Yeah, incredibly important question, and clearly our frontline warriors across the country are doing just such important work. Similarly, about a month ago, we offered free behavioral health coaching for all frontline healthcare workers from a US-based health system. So that means 24/7 access to a live conversation, typically 47-second response time, 24 hours a day, 7 days a week, to these providers who have incredibly stressful schedules and challenging schedules, frankly. So they're going to get access to this level of support that's really, really critical and really needed. So please reach out if you do. Would love to be able to understand if we can support that community. And just as importantly, for those that through vicarious trauma might be actually responding or supporting those that are supporting others, we've made a lot of the in-app resources that we've developed in particular with a focus on COVID-19 free and available to the general public. So we have a set of content that's based on evidence-based best practice that's available on our website, ginger.io/roots, and happy to follow up with it offline as well. But there's a set of content to a lot of the issues that I think both David and Roni were describing of social isolation and anxiety and relationship issues that are clearly front and center for many people. These are some free and available resources that anyone can access right now on the website.
Excellent, thank you. We will definitely collect those links so that we can share them. I want to be thoughtful about time, so this might be the last question, but I'm excited to ask it because I think a lot of us who work in this space and have been writing and reading constantly are equally curious about this question. So how do you think the increased focus on mental health during COVID-19 will change how people perceive it once the pandemic is over? What do you think the effects will be? You know, do you think we'll have a long-term more, will we have shifted stigma and culture and conversation forever? What are your thoughts?
Yeah, I think that the same way remote work is going to be more acceptable, I think the many changes that are happening now, like there's people getting married over Zoom, right? And that's legally binding. I think that they're going to keep that. Why would they? Why are they going to go back in time, right? And I think that same thing with like people are going to. It's like virtual health takes a while to get adjusted to. And I think that in my opinion, that people that are getting virtual help now that find that it works in their convenience of their home, they're going to stick to it. And there's a lot of things that we're sticking to. For example, like home workouts. People are going to be like, wait, I don't need to go to Equinox and go put my stuff in a locker and small talk to the front. I'm getting just as in shape working from home. So a lot of things are going to change. The people that adapt and evolve, they usually go with, hey, this is working and this was more convenient. They're going to stick with it. But again, you never know. We don't know how long this is going to last, right? So if this builds a habit that this is basically all you know, that's what you're going to stick to doing, I think.
I think, as people are turning to remote care solutions, because private practice is basically shut down and they don't have any other choice, basically they realize that not only is it safe, but it's also more convenient, more affordable, more accessible, more immediate, and at the same time they're receiving high quality care. So it wouldn't make any sense for people to go back to inconvenient, inaccessible, more expensive traditional solutions, because they're really experiencing right now the benefit of digital mental health care. So I believe that this pandemic changed consumer behavior and it changed it forever. That's what I believe.
I agree with that.
Yeah.
We are a
Yeah.
species of evolve. You know, we evolve. With what we have and what works, and the strong people stick. I remember when Uber started, nobody thought they would ever call somebody on the internet and the car would pull up. And none of my friends were like, we're going to use that. We're going to hail a cab.
Yeah.
Now,
I think that once you really feel that the benefits, experiencing them, then it's hard to go back.
100%.
Karen, do you have thoughts?
Yeah, I think we're all in alignment on this one. I think we're all taking a breath in. We're stressed as a country. We're seeking these resources. We're seeing it's incredibly powerful and a great way to get access to care. And so, yeah, my dream is that we start to drop those labels of virtual care and telehealth, and it just becomes care and health. And we even start to think about mental health as really just health, right? And I think it's a combination of both of those that are really coming together. Which I think is going to be a phase shift, because this is the impact of this. If this ends soon-ish, it's still going to be felt for years and years to come, because there are long-term consequences for what we're all going through right now. And so I'm really hopeful that people are going to realize that great people, great clinicians, plus great technology coming together, that's the solution. That's what's going to actually help us address the supply and demand imbalance and all of the access challenges that we've allowed to persist for decades.
Yeah, I couldn't agree more about the terms like, telehealth, virtual care, remote care solution. It's online therapy. This is just therapy or mental health care. And it's just like, as you are mentioning, the fact that technology is involved and basically just expanding access doesn't mean that this is not, it needs another term.
Sure. Yeah. And I think what's really exciting, I hope, and really hopeful for everybody who's, working around the clock on this, is the combination of eliminating that barrier and that stigma during this time, combined with, mental health really getting headlines every single day. That combination will create a totally different future for addressing the needs and reducing stigma and shifting culture and conversation. And, and I think we all collectively hope that there is a near future where having a broken bone is talked about and treated in the very same way as our minds are. So I think I speak for all of us in saying that. We have about 30 seconds left, so I want to just thank you all tremendously. I know you are all really busy people, and I think we're all really passionate about this. And thank you to all the participants on today's call. As a reminder, the webinar was recorded, so we will share a link and it will be posted. We will include any resources that were mentioned on today's call that these wonderful thought leaders send our way. We will be sure to include them in our follow-up thank you message. And as a reminder, this is one of a series of conversations. We had another discussion last week and the week before with the National Council for Behavioral Health. And so it is our goal to continue to talk about how companies can provide support for their employees, and also how they can specifically help communities around this work and build partnerships that are really helping to address some of these needs, like free hours and crisis text lines and things like that. So stay tuned for more events. We thank you all. I hope those on the East Coast have a wonderful evening, and those on the West Coast have a great rest of your day. And we will talk to you all soon.
Thank you. Thank you very much for having us.
Thanks, everybody.
Thank you. Bye-bye.
Take care.
Bye.
Bye.